Hello, I'm Arti Pol. This is CBC News Network. We begin the hour with a major announcement out of British Columbia related to the deadly opioid crisis. Starting next January, the province will become the first jurisdiction in North America to decriminalize small-scale possession of hard drugs. Federal and provincial ministers revealed new details about the changes earlier this afternoon.
As of January 31st, 2023, adults 18 and over in British Columbia will no longer be subject to criminal charges for the possession of up to 2.5 grams of certain illegal drugs for personal use, and the drugs will not be confiscated. Minister Malcolmson and I want to be very clear. This is not legalization. We have not taken this decision lightly. We have been working with the province over the past months to ensure that their final application was able to meet the criteria necessary for Canada to be able to grant a province-wide Section 56 exemption to the Canadian Drug and Substances Act. This time-limited exemption is the first of its kind in Canada, and with it comes great responsibility.
And Sarah Galashan is back with us again. She has been following this announcement in Vancouver. So the announcement again comes 6 years after BC declared a public health emergency. And in that time, nearly 10,000 people have died due to toxic overdoses. So take us through just how significant this is.
It's a big step. You heard the health minister there say, or the Minister of Mental Health and Addiction say that this is a first for Canada, and certainly it's something that advocates within British Columbia have been pushing for since last fall. They've been talking about it. The amount that has been decriminalized here is 2.5 grams of accumulative amounts of opioids, cocaine, methamphetamines, MDMA. But really what we were talking about here when we talk about drug poisoning, because that's the other way that this is described by people, is the deadly amount of fentanyl that is cut into a lot of these street drugs, which leads to these to overdoses that result in death. And partly those overdoses that result in death are happening because people feel a stigma and are using these drugs. They are people who are addicted to these drugs and are using them privately because of shame and stigma. And so what you heard here is that they will no longer be subject to arrest or have their drugs seized or taken away from them. They also won't be forced to seek treatment either, though, but they will be provided information on that and encouraged to do so as a possible way of trying to save lives here. The 2.5 grams that has been decriminalized, I will point out that drug user advocates in this province had, when the application went forward, argued that the 4.5 grams that the province was initially asking for, that wasn't enough, that people who are addicted to drugs would likely have more in their possession, and that the ask should be even greater. And in fact, we heard in April that while Health Canada was considering this, it was likely to come in less than 4.5 grams, and here it has. It's now 2.5 grams. So we'll be looking for a reaction to that. But Arthi, really, it is a big deal. I mean, you saw the smiles on the faces of all of those authority figures who were at that press conference talking about how hard they've been working toward this goal. The mayor saying that when he first heard this was going to happen, he felt like crying, and that he still does from relief. Dr. Bonnie Henry, the provincial health officer, making some important points when she was speaking, saying that this is not going to fix the problem. I want to play you a little bit more on her perspective there.
This is not the one single bullet, the one single thing that will reverse this crisis, but we have seen clearly how important it is that this, along with the advancements that we're making in safer supply, will make a difference in curbing the tragedy that we have seen. I have always been committed to supporting people who use drugs, and one complex piece of this solution is this right now Section 56 exemption that allows us to start doing that work.
So as we sort of heard there, Sarah, this is being billed as a public health approach focused on reducing harms and saving lives. How exactly will it do that?
Mm-hmm. Well, so harm reduction is a term that we've been hearing in British Columbia for more than 20 years now, and this is just one more step toward what we call harm reduction. The way we've been told almost monthly, because they update the figures of those who've died from suspected drug overdoses almost every month, actually, in British Columbia. And the point is repeatedly made that because people are using these drugs privately, there's no one to assist and to call for help in the event of an overdose. As well, when they are incarcerated, when they're arrested and put in jail, that time spent in jail is drug-free time. But when people are dealing with addiction, they leave jail and then seek those street drugs, too often in amounts that are deadly. And so incarceration is therefore associated as well with these overdoses. But you also heard Dr. Bonnie Henry talk about safe supply, and Carolyn Bennett, the federal minister, also talked about the importance of safe supply, saying that that is going to be the next step that they are pushing towards as well, because the decriminalization of these drugs in small amounts is really only one piece of the puzzle, they say, that needs to be in place in order to really tackle this issue. And by providing safe supply, which means you have a clean drugs that can be prescribed by a medical professional to someone who is dealing with addiction, so that they can get what they need without having to deal with these deadly combinations that they're getting in the street. That is seen as a very important puzzle piece. And the federal minister encouraging to those who are advocating for this, that she said that that is where she is pushing toward next. Arthi?
Thank you for this, Sarah. That is the CBC's Sarah Galashan reporting for us live in Vancouver.